Good morning. We're just letting people jump on here. We'll give it a couple more minutes. Good morning. We're just letting people join here. If you have not already, please leave your name and organization in the chat. Good morning, everyone. Do we have Nancy Maxwell on? Maybe not yet. She's our first presenter, so I'm just waiting here a couple minutes for her to join. Well, I was waiting for one of our presenters to jump on, but I think we can go ahead and get started. Is Nancy Maxwell on the line or on the phone? Okay, Kathy Rainey just joined. Kathy, we might have you go first here in just a minute and give your update. Morning, Kathy. I might have you go first here. Just give me a couple minutes for the kickoff here, and then I'll throw it to you. Okay.
Sounds great. I'm having some technical difficulty.
Well, we can hear you just fine, so I think you're good for now.
Thank you, Matt.
So welcome, everyone. My name is Matt Leverseed. I am the Health Education Director here at Jackson County Health Department. And for those of you that maybe missed the last call, Jackson County Health Department is now facilitating the future Jackson County Healthy Communities Coalition meetings for the foreseeable future. So this will be the second meeting that we've hosted. Our next meeting is going to be September 28th. And then in 2024, we're actually going to a quarterly meeting. So we're only going to have 4 meetings for next year. And I can pull this up really quick for everybody to take a look at. So here's what we have remaining. Like I mentioned, September 28th, and then for 24, we have January 18th, April 18th, July 18th, and October 17th. So those meetings should have gone out already. If you don't have those, just reach out to me. here at the health department, and I can send those to you. So for today, we have a program highlight. We have Kathy Rainey from Centerstone. She's going to be giving us an introduction into the Connections program. And let me pull up her information here. All right. So Kathy, I'll go ahead and hand it off to you, and we appreciate you being on this morning. So I'll leave it to you.
Okay, thank you, Matt. Hello, everyone. I just want to say I am Kathy Rainey from the Connections program within Centerstone of Illinois. My location is the Marion office. And Matt, I don't have my presentation up. I don't know what's going on, so I'm just going to go ahead with it the best I can here. Okay, I have sent Matt a Connections flyer that says a little bit about what we do. And I have also sent him a referral form. I'm hoping you'll be able to share that with everyone on here, Matt. And I want to get into it a little bit. What we do is we have case managers, a recovery specialist, and myself. And we provide services to people in Williamson County, Franklin County, Union County, and Jackson County. Part of the eligibility requirements is housing instability. So yes, while we do actively work with people living on the street, we also provide services to people that are getting evicted, couch surfing. There's various reasons. If it's not housing, it's housing stability the person has, then they require for that part of our program. The other thing, the eligibility requirements is substance use. I usually look for someone that actively uses or has used within the last year. But if they've used within the last year and close to relapsing, we take those also into Connections. We provide services to people 18 years and older. And then I just said the counties that we provide services to. Some of the Connections goals is secure housing. That's our number one. Secure the housing. And then we secure employment, and which also includes any income, because a lot of the people that we work with have no income. So we have to have income prior to housing, unless we look into our county housings where they can get in there. And let's see. Also, we are trained to help people sign up for Social Security disability, veterans benefits, anything that they would need. And the main thing we do for people is we build support systems. That's a part of our program also, because a lot of people don't have any supports, or the supports they've had in the past is a part of their history of using. Absolutely reduce substance use. We have various places that we can work with. At Centerstone, they will have a managing clinician, a therapist, a substance use therapist. And then what my team does is my team will get them involved in NA, AA. Just recently, I've had quite a few people ask for religious Celebrate Recovery through the churches. And overall, what we do, not only do we help with the homelessness, the income, and the substance use, we also improve their mental and mental and medical and dental and vision. We try to improve all of those things while they're with us. The one we're having the most referrals right now, to be honest, is from probation officers. And that is to reduce court system involvement. We have several that is in drug court in our 4 counties we provide services to. But there really isn't a lot of limitations with being in our program. The main thing, like I said, I look at homelessness, unstable housing, and substance use. Because the substance use is so important. This is our 4th year for our program at Centerstone. And we also keep data and statistics and things like that. I met with one of our research people that works along beside me. And in the last 3 years, we have had 72% people say they have had trauma in their lifetime. So that is high. That's real high. We do trauma-informed services also. My staff's fully trained in that area. And I have 10 minutes and I'd like to open up to questions, because that's the basics of what our program does and provides. Would anyone like to ask me a question?
Well, I'll ask the question. Kathy, are you able to see your flyer here on the screen?
No.
So I'll ask some questions.
Hi.
Kathy, Angie from SIH, I was wondering if you could talk to like how many people are in the program currently, like number of staff, number of served since the program started, and then also if there's an individual who has a mental health disorder. So I know it says co-occurring, but can those individuals be served as with a mental health disorder, or must they also have a substance use disorder?
Great question. Yes, I did kind of skip over that. I didn't have it on my cheat sheet. We do a co-occurring. The problem that we've had with is the severe mental illnesses. Being schizophrenia, one of the most severe mental illnesses. The way we have our program set up, we use an evidence-based.
Oh, can anybody hear her? I think you've cut out. Something's happened with your audio. Yeah, we still can't hear you.
Okay.
Now we can.
Okay. Let me move up a little bit here. You guys are cutting in and out a lot for me. I hope it's not just me. But anyway, when we look at that, what the critical time intervention is once they're housed, that starts a 9-month clock. So they move into phase 1. Phase 1 is 3 months. In those 3 months, we want to be sure that we're helping them. They're already housed. They already have income at phase 1. So then for 3 months, we work with them still on the natural supports. We work with them on their substance, of course, but then we also work to get them in their communities and really know their communities and utilize them. We have a wide variety of resources because I've obtained them over the last 3 years. I really appreciate our community partners. So anyway, after the 3 months, we reevaluate and we move them in phase 2. In phase 2, we don't see them as often. I mean, we're there for them for 3 months, but we just don't quite see them as often as we do prior to housing and the 3 months after being housed.
Oh, you cut out again. Can any?
Technically, we see them once a month for 3 months. That doesn't always work out because, sometimes there's relapse. Sometimes, there's added trauma. Something happens in their lives. But that's the way we like to do it, if we can do it. So that person we have their back for 3 months in phase 3. Then they phase out of our program. So to answer your question, Angie, it's hard with a severe mental illness like schizophrenia because those people need ongoing treatment for their mental illness. But honestly, I've taken people in the last 3 years, I've taken them in diagnosed with schizophrenia, but they are 100% medicated and they follow through with all their mental health issues, and they have graduated in 9 months after being housed. So I won't say I won't, but it depends on the individual, of course. So I hope I answered that question.
Yeah, and since we're cutting out, I wrote all my questions in the chat. I don't know if you can see the chat. Now we can't hear you again.
Can you hear us, Kathy? Are you still there, Kathy, or did we lose you?
No, I can hear you now.
Okay.
I couldn't hear anything for a while, Matt.
Okay. So here's a question. Can you serve individuals with mental health issues only? And then individuals with severe mental illness or other mental health disorders, what does that kind of look like?
Okay. No, actually, our connections is set up. You need to have unstable housing and you need to have a substance use diagnosis. And like I said, we do co-occurring mental health. It just depends on the severity.
Okay, thank you.
You're welcome.
So are there any other questions for Kathy this morning? We appreciate you being on. I know with technical difficulties, sometimes it's hard, but we were able to hear you 95% of the time. I'm going to put the information for your program here in the chat also, so everyone has access to that. But do we have any other questions for Kathy this morning?
Matt, are you going to be able to oh, I'm sorry. Go ahead, Alicia.
So the question here in the chat box was, do you do outreach and how do we refer patients to you? So Kathy actually sent me a referral form. So following this meeting, I'll send those documents. That way you all will have this information on how to refer individuals to the Connections program.
And yes, we do outreach. My case managers completely work in the field, out in the communities.
All right. Well, great, Kathy. Thank you very much for being on this morning. Do we have Nancy Maxwell on? I haven't seen her name pop up. Nancy, can you hear us? Okay, maybe we'll give her a couple minutes. Maybe she thought it was at 9 o'clock. So some other items that I had for today's agenda is for meetings in 2024. Just wanted to get some thoughts and ideas, suggestions on what you might want to look or have this format look like going forward. Typically what we've had is kind of usually a program present or an agency presentation, and then we've had a program highlight, and then we've kind of done the around the room updates. And that was more when we were meeting kind of in person physically. What I've been doing, at least so far, for updates or asking for those ahead of time, and then we're posting those to our JCHD website so people can go back and review those at a later time, or if they happen to miss the meeting, you don't miss the updates. So just wanted to open it up. I'm not married to any direction or anything like that, so just open it up for a couple minutes while we wait for Nancy maybe to jump on here, and I'll open the floor to anyone.
So I'll step in. I mean, I'll just say one thing, Matt. I like it when we do the report outs by the action teams, just so everyone can like see the person's face and know who it is. I do like the new format of us emailing our reports to you ahead, so you can have that available and posted for everyone, and it cuts down on the minutes and the information. And then I also like the announcements at the end. So I don't know how everyone else feels, or, so just put my 2 cents.
Thank you, Angie. And we actually might do updates today. Since I'm not seeing Nancy jump on yet. Is Nancy Maxwell on? Okay. Any other thoughts or ideas on what this format might look like going forward?
I'll just say, this is Angie Keel. I'll just say I concur with Angie Bailey about reports out and sharing at the end. I think that gives an opportunity for folks to ask direct questions and things, and I think that's a valuable aspect of this format.
Okay, thank you, Angie.
And I agree with that. I think being able to share upcoming events or current happenings just helps build support for those types of activities happening throughout the county with our organizations. So I do like the time to do agency updates and sharing.
Okay, thank you, Tony K. We had a question in the text from Amber. Will these be returning to in-person? That's to be determined. I do have on my calendar that we're going to be looking at some possible space, maybe in a new location instead of the chamber where we used to have these meetings. Right now, the convenience of having these online are very advantageous. Next year in 24, when we go to a quarterly format, we might try and do these in person and then offer a remote call in also for individuals that might not be in town or they want to join remotely. So we are looking at that. But for now, at least for the remainder of this year, we're probably just going to keep it through WebEx. And I know it's difficult with technology and not being able to see the physical person. It's a little challenging, but you know, we are still kind of transitioning out of a strange time. So I do appreciate the feedback. So what I think we might do is Nancy Maxwell on. Has she joined? I haven't seen her on.
Yeah, I tried to text her. I'll try to give her a call too.
Okay. Well, in the meantime, I think I'm going to put our action team co-chairs on the spot and see if we can't go around the room and actually do provide updates this morning since we do have some time. So can we start with behavioral health? Is Ashley Moss or Yvonne on this morning?
Yeah, hey Matt, Ashley's on. Or this is Ashley, how's that? So Behavioral Health Action Team just met last week on Thursday, and we are moving forward with our self-care campaign. And we kicked off the summer one just after Memorial Day, received some good feedback, and this is really for behavioral health providers. We sent out a survey with interest and then returning that back to them individually just that way. And so we'll be using our time as we meet to put out our fall self-care campaign. So just doing seasons by the quarter right now. And then our next meeting, as you can see here, is Thursday, September 21st at 1:30, and we are still meeting by Zoom. I agree with Matt. I think we're just finding it to be a better use of all of our time. So thank you.
Thank you, Ashley. So you are able to view this hopefully on my screen.
Yes.
Great. So for built environment, Angie, I wasn't able to get your information on this morning, so I do apologize. So I will hand it off to you next for the built environment update, unless Molly wants to go first.
Molly would not be able to join us this morning in the meeting, so I'll be speaking for our action team. We've got some exciting new developments happening in Carbondale with the multimodal center groundbreaking. That's an exciting aspect. We've got a new bike path under construction happening. It may even be complete, but I know it was near construction end. The crosswalk at the Carbondale Farmers Market, that's going in. But one thing that's kind of time pressing that I'd like to share or highlight to everyone is that right now, IDOT, Illinois Department of Transportation, has an online survey and also an interactive map where you can go into the map and actually pinpoint intersections or locations and provide suggestions for updates or adaptations that would make our infrastructure more accessible for those that are rolling, biking, and walking members of our community. And I think that it's sometimes a challenge to get our more at-risk folks to access these kinds of surveys and information. So if you hear of any clients that you work with talking about challenges in their daily routines of trying to get to the grocery store or destinations that would be valuable to everyone to be able to access if they could get there by sidewalk or by riding a bike, try and capture that data and input it if you can find the time. I'm going to put the link in the chat to the website where you can go to take the survey and use the interactive map that IDOT has created. There's also a tutorial there to show you how to use the map. And I was kind of I'd like to see more dots in the Carbondale Jackson County as a whole area, because we know as residents and people that live and work here that there are challenges in our infrastructure, and we want to make sure that it's accessible to everyone. I have changed hats. I've moved over from the health ed division. I'm over in the environmental health division here at the health department now. And one thing that kind of is coming up, or not kind of, is coming up, is the Jackson County Solid Waste and Recycling Plan will be sharing a survey for folks that live and work in Jackson County to gather information about solid waste and recycling issues that they see and ideas and suggestions that they'd like to see as we plan for the next 5 to 20 years of addressing those issues in the county. Our next meeting for our Built Environment Action Team will be the 11th of August. We'll meet by Zoom. If you'd like to join us, we'd love to have you. Let me know or contact Molly Maxwell at the City of Carbondale. Thank you.
Thank you very much, Angie. And I do have the link to the Illinois Department of Transportation survey at the bottom of our of this form that you're looking at as well. So if individuals didn't get that from the chat, they'll have it on this document as well. So thank you. For Diabetes Today resource team, Fanta is actually doing a youth mental health first aid training today. And I don't know if Debbie is on.
It's Angie. If Debbie's not, I can share Fanta's update.
Okay, thank you.
So they did meet June 22nd. They continue to invite and recruit new members. Debbie Johnson and Fanta are the co-chairs. They are switching to a hybrid format, so meeting in person for those who can, and those who can't can join online. We have 2 cohorts of the diabetes prevention year-long course going on right now. One is held in Carbondale and one is in Heron. So they're having really great participation. So the first cohort of the year-long will end in January, and then the second cohort will end in May of 24. And then looking to continue to offer those maybe twice a year in the future, but it is pretty intense. And if you're interested in learning more, you can just Google CDC and diabetes prevention program. Camp Beta, the camp for children with type 1 diabetes, is going to be held on September 23rd and 24th. Right now, we only have 12 youth signed up. So we are really asking that everyone help promote it to any families that you know that have children with type 1 diabetes. It's open to children ages 10 to 16. It is free. It's one overnight at Touch of Nature. They have a great time, and on the HSIDN, if you look up Camp Beta, you can find out information, or the Touch of Nature site. And then there's information on here about the chronic disease self-management program. Some additional of those are happening. You can reach out to Fanta for more information there. And then November 14th is World Diabetes Day, and Diabetes Awareness Month is in November. So they're planning some activities. Next meeting, August 24th. So please reach out to Fanta or Debbie for more information. And if you have any questions about Camp Beta or interested in volunteering, it's a great partnership with the health departments and Touch of Nature and SIU, food nutrition program, and many others working together to make that a free camp for the kids.
Great, thank you very much, Angie. Healthy Living Action Team, Tony K or Nikki, do you have any updates for us?
Yeah, I'll just mention, I apologize for not sending you the report, but I will just mention, we did launch a Facebook page for the action team. It's Healthy Living Jackson County, Illinois. We'd encourage you to like and share it. We are working to build up followers. So with that, we're focusing on a fruit and veggie campaign, highlighting a different produce each week. Once we build up followers, we do hope to use it to support and promote other current events, as well as eventually use it to facilitate a countywide physical activity challenge. So I encourage you to like on Facebook, Healthy Living, Jackson County, Illinois. I'll also mention that working with the Catch On to Health Consortium and our ABCs of School Nutrition and Illinois State Board of Education, we are hosting School Lunch Rocks Workshop next Wednesday, and Sherry and I are emailing back and forth every day because we're at 98 participants and we can only accommodate 100. So looking forward to being able to provide 4 hours of continuing education to our school food service staff across the region. The Southern Illinois Food Pantry Network will have our quarterly meeting on Thursday, August 24th. It's hybrid, so it will be offered via Zoom as well as in person at the Illinois Extension office in Murfreesboro. And then the Southern Illinois Food Security Summit, registration is open at feedsi.org. It's scheduled for Tuesday, September 12th at John A. Logan College also. Registration is $20. We do have a few scholarships available if that is an issue for some. And then the Healthy Living Action Team is also meeting hybrid. We meet at the Carbondale Park District on Giant City Road or via Zoom if you'd like the link to attend our next meeting, which will be Monday, August 28th, which is not our typical day because of the Labor Day holiday. Monday, August 28th at 1 p.m. Just reach out if you're interested. Thank you so much.
Great. Thank you very much, Tony K. For our Healthy Seniors Action Team, do we have Becky or Robin on? I didn't think I saw them. Joint access to care. I believe I saw Alicia on. Did I not?
Yeah, I'm here. I'm sorry.
Oh, okay, great.
So we met on June 20th. We also did a community screening on June 26th at the Heron House of Hope. That went very well. We did screenings for blood pressure and spoke with the community. We continually need to we're actually working on our HSIDN resource guides. Hopefully it'll be current soon. We're hoping to be all done in August. We're inviting any new recruits. We would love to have new members join us to help the cause. We're also always looking for new events to go with. We have an upcoming community screening health fair event August 22nd, September 30th. One's at the Heaven Kitchen in Harrisburg. We have the Carbondale Civic Center in Carbondale. And then we have reminders. Open enrollment for Medicare is October 15th and December 7th. Open enrollment for healthcare.gov, the marketplace, is November 1st to December 15th. I know Shawnee Health has ship counselors and to help the community. I know EAAA does also for Medicare. And then Shawnee has licensed navigators, which are they're licensed insurance providers. And we have to see everyone in the community with these licenses. So if they're not a patient of ours, we still are required to help everyone with their insurance coverage, just to give that out to you all, because I know sometimes if you're not a Shawnee patient, they're scared to send them to us, and we help no matter what. Our next meeting is August 15th from 1:30 to 3 via Microsoft Zoom. You can send me or Fanta an email to get on the list. We would love to invite everyone that wants to be on the Joint Access to Care team.
Thank you very much, Alicia. We appreciate that. Positive youth development. I did see Sherry. Do you want to highlight anything?
Sure. So first and foremost, we are always accepting new members, especially if you want to work on stuff. We also need a co-chair to take Mallory's place. So if you really feel that's speaking to your heart and you would love to be a co-chair, contact me. We would love to have your help. Family vacation night. Our next one, we will be partnering with Carbondale Public Library Sunday, August 6th. So if you've never been to a foam party, here is your chance. It's the end of summer reading foam party that's at the library. And then we are working on planning some other family vacation nights. So hopefully we can do a repeat of what we did last October at the Orchard there in Murfreesboro. And at our last meeting, we were able to meet in person. We did a hybrid setup. So we pulled out our strategic plan so we could update some goals and really try to redirect maybe our focus, set some new goals, and move towards the future. So We may also be looking at changing the day time of the meeting, but for right now, it's still the same. So our next meeting, it will be virtual, but it's August 15th at 11:15. So if you would like to be invited to that, you can contact me and I'll put my email in the chat.
Great, thank you very much, Sherry. Public health and medical preparedness. I believe I saw Jamie on. Jamie or Bart, do you have any highlights?
I'm here. So as part of the Together for Safer Illinois efforts to save lives and reduce firearm-related injuries, IDPH Public Health Violence and Injury Prevention Section partnered with the U.S. Department of Veteran Affairs to for the health departments to be able to get cable gun locks and supporting education materials. And we are getting those out in the community. We are set to give SIH some to give out during the safety fair. We've already given some to the sheriff's department. So that's a good positive thing for the community. And then also we have just a reminder to make sure that people are scheduling the back to school vaccines and not waiting until super last minute, but I know school's about to be starting, so it's probably getting to be about last minute. And we have started some planning for the eclipse with community partners. There's several meetings coming up to kind of start internal planning and seeing what the other community partners are getting started. That's all I have.
All right, great. Thank you, Jamie. I looked at the calendar. It looks like school starts in about 3 weeks. So I guess where did the summer go? Let's see, sexual health. Philip, I believe I saw that you were on. Do you have any highlights?
I sure do. As noted on the report, we had 3 in-person interactive trainings with Shawnee Healthcare in their Carterville, Carbondale, and Marion locations. We have an upcoming training also scheduled for August at the Murfreesboro Clinic. And then we had an opportunity to provide a sexual health and HIV orientation to an SIU family medicine resident who spent some days here at the health department. The health department also participated in Carbondale Pride Fest on June the 10th. We had 2 booths. One was immunizations and the other was HIV, sexual health, and prevention. It was a lot of fun, and the Pride Fest was really well attended this year. There are sexual health clinic appointments and PrEP clinic appointments available. Our PrEP clinic is very popular, and so those appointments go quickly. So if you know of anyone that may be interested, please give us a call here at the health department, and we'll get them scheduled. The team is working on a electronic version of a sexual health resource guide that we hope to make available this fall. Our next in-person meeting is August the 9th. That will be here at the health department at 3 o'clock in the conference room of the Bax building. Thanks, Matt.
Yeah, thank you, Philip. We appreciate that. Is Angie Bailey still on? Do you have an update or highlights for the Southern Illinois Cancer Action Network?
Yeah, so we did put a link to our fact sheet is on the meeting minutes that'll go out of this report sheet. So that is there. Jamie Courier and I co-chair that. I was not able to be at the last meeting, but they did have a great meeting, great announcements. So I know this is out of our area, but there's going to be a screening event with Fit Kit distribution and the walk through Colon and Mount Vernon on August 9th. At their city park. Southern 7 is looking for more individuals who are interested in genetic breast cancer testing. So if you know anyone who may be interested and has a history of breast cancer, you can contact Southern 7 Health Department. We are a 16 county coalition, so that is why we have so many, and then Mount Vernon joins because they're also nearby and serve a lot of individuals in our area. American Cancer Society has a really great I Love You Get Screened campaign on social media. If you haven't seen this video on Facebook, take a look at that and please share it. It just encourages everyone to get screened and to talk to your healthcare providers about that. And then there's a lot going on with the different tobacco coalitions. So Jackson County is part of the Southern Illinois Tobacco Partnership. So you can learn more about that and talk to Christina at Jackson County Health Department to learn more there. And then the IDPH Tobacco Disparities Grant has the Southern Illinois Tobacco Disparities Partnership. So you can reach out to Kelly Corner or Kendra Minshew about that. And they also have lots of social media, Facebook, Instagram, all these different pages. And then there are 4 different action teams that you can join or get involved with. Yesterday, they had a great presentation around advocacy and youth and what we could do around developing new rules or laws or ordinances or enforcing current ordinances to reduce sales to youth. So that was really great. And they have lots of free materials to distribute. The next meeting of the team is September 19th from 2 to 3:30. And we do meet every other month. And Kendra did put in the chat information on how to get to all the social media platforms for the Southern Illinois Tobacco Disparities Partnership.
Great. Thank you very much, Angie. So just additional community reports that I've received. So just one for Jackson County Health Department. We're currently hiring 4 positions, a health educator position. We're also hiring for a marketing and outreach coordinator. And then we also have 2 part-time individuals. So one, we're looking for a registered nurse. I believe that's for our immunization programming. And then also a part-time WIC, women, infant, children, nutritionist. So if anyone's interested, we've got the career information on our website, or you can reach out to Heather. She is our new HR coordinator here at the health department. So just reach out to us if you are interested. Let's see. So the IDOT update, Angie Keel kind of gave this update. So here's the initiative link, and I'll send this form out to everyone following the meeting, as well as their survey, and then the interactive map that she had talked about. And then also for any schools that you might work with, they are rolling out the Safe Routes to School funding again. I actually don't know the dollar amount, but they do have a couple of kind of kickoff webinars, Q&A that are coming up August 23rd. So if you're interested, we have the registration there as well. And then Kendra or Kelly, do you want to give any quick highlight on Southern Illinois Tobacco Disparities Partnership?
Thank you, Matt. I do believe that Angie already went over our information, but I do want to comment that we are offering trainings when you come to any of our meetings through the CAD/CAGIA Encounter tools, and they can be very helpful. And we're really promoting getting our educational materials out there. We want to saturate the 16 county region so that everyone knows how to reach the quit line and or how they can come up with a Courage to Quit class in their area. So if you have any referrals or any interest, please contact Kendra or I.
Great, thank you very much. And I do believe, is Nancy Maxwell or representative on from Carbondale United?
Hi, can everyone hear me?
Yeah.
Okay, I'm operating on a new computer, so I even see myself right now. Okay, I didn't realize we were going to do a presentation. I think Nancy was supposed to do this, but I'm going to jump in here and talk a little bit about Carbondale United today. We are a grassroots nonprofit that was started in 2019 when Nancy's son was shot and killed. And then in the wake of the George Floyd murder, we gained a lot of traction in the community. We're modeled after Chicago's Cure Violence program, which treats violence as a contagion. So if you take data and you look at gun violence, kind of plotted on a map, it looks and acts very similar to a virus or a virus, a contagion of some kind. So here at Carbondale United, we have, next slide, please. I'm not sure if okay, yeah. So we know that violence clusters, it goes in waves. It's almost predictable. Like in the summertime, we know it's going to go up. For example, there's a lot of data on there. We know it's also super important to stop the transmission of it by sort of containing it. How we do that is different ways. We have violence interrupters who are actually dispatched to maybe a hospital, maybe after a shooting, to talk to the family or talk to the friends of the people involved, so to prevent like retaliatory measures. Our violence interrupters also work as like a community contact point for individuals where gun violence is more prevalent, and those communities are usually impoverished and underprivileged and have lacking access to education and other resources. And we also, as an organization, do a lot to change kind of the group norm stereotypes in the community by offering multiple programming opportunities. We've been trying to get for example, a group of young men together to take a trip to the Equal Justice Institute in Montgomery, Alabama, as like a concrete detail of programming that we do that way. So here is the Cure Violence model. We do, I think, yes, provide crisis intervention. I guess that would be where our partners at SIH or other community organizations would come in. You know, if you know of someone, maybe at the hospital, someone presents with a gunshot wound, for example, Carbondale United would be called, and we have, yeah, I'm trying to use the video. For some reason, I can't, it's not working. Anyway, next slide. Yeah, so the reason, or one of the reasons our violence interrupters are so effective is because they are members of the community. All of our violence interrupters are persons who have been impacted by the justice system. So without this personal kind of street credibility, we would not be as effective. So we're acting as a kind of moderating force, but we're certainly not the police. It's an alternative to the police. And in our, especially the northeast side of Carbondale, it's important to have that, an access person who's trustworthy, I guess, in the eyes of the community to talk to. So if someone knows that, you know, 2 houses down, they have a real conflict going with another group of individuals, this is where our violence interrupters are sent out to kind of discuss things. Also, we have, next slide. I have not seen this presentation yet. I'm sorry. We have a building located at 309 East Jackson. We have a large community room, and we have used that building as a sort of neutral ground for parties who have problems with one another to come and discuss things rather than just use a gun. So this is where I guess I'm going over like our community partners. We do partner with law enforcement on some things. This summer we had some issues with some really young people out just doing kind of breaking into other apartment complex pools, for example. This is not something the police want to really get involved in, but it's certainly an opportunity for like a violence interrupter to step in and offer another way to be for these young people. All right, next slide. So ideally, as I mentioned before, if the hospital were to receive a patient with a gunshot wound, a stabbing, some sort of violent wounding, the hospital would call our emergency line, and we would dispatch a violence interrupter to show up. There was an incident a couple of months ago where there was a murder in Carbondale, and Nancy and I actually, because our violence interrupters were both unavailable, showed up at the hospital, and a large crowd had gathered in the parking lot, and we were there to do the best we could to talk to some people before it became another issue. But that's usually that we have a lot of data that supports. This is a lot of times when people in their feelings will kind of decide in a premeditated way to get back at another family. And this is where our violence interrupters would come in and to prevent that retaliatory measure. So also other cities, New York, Philadelphia, Chicago, have models just like Carbondale United.
Someone is at the front door bell.
And we have a lot of data to support the effectiveness of these programs, which hopefully we can have these slides emailed out to everyone.
Yes, absolutely.
Okay, great. Next slide. So here are our numbers. And here's our two main violence interrupters. We have volunteer interrupters. I believe those do look like correct numbers. So Herrick's is my maiden name. Is what I usually go by. But it says Booth here. So if anyone has any questions, I'd be happy to answer them.
Great. Thank you very much for stepping in, Jessica. I'm sure this was very difficult.
Yeah, I am sorry this was so clunky. Not usually the face of Carbondale United. It's usually Nancy or our violence interrupters.
Sure. I just one quick question I had. As far as partnership with the city of Carbondale, the actual government, I mean, has that inroads been made with your organization, or kind of where are they at? I know there was a lot of turnover on the city council and kind of managers, and can you just talk a little bit about how that's worked so far, or?
The city, as far as
working towards violence reduction
with the police department, sure. We do have a working relationship with the police department. Was last weekend or weekend before there was a shooting. It was non-fatal, and they did call us to come to the scene, and then we did go to the hospital, and then eventually to the police station. And I sat in the Can you close that door? I sat in the sort of the waiting room with the family, and we discussed options. Obviously, they were very upset, so it's good to have someone who's not police, who's not medical staff, who's not necessarily in a uniform, kind of portraying authority, if you will, with a family, so you can get a lot of information. And we do have a healthy working relationship with the police. We do feel like we're on the same team. However, we have different approaches. So so far so good. I'm optimistic that we can continue to maintain a good working relationship with them, and they will continue to call us.
Yeah, that's great. Thank you. Do we have any other questions for Jessica this morning? And again, we appreciate her being on.
Can I just quickly too, we have a community gun violence meeting tonight at our East Jackson office. I'd love to invite you all here. It's at 6 p.m. from 6 to 7. So it's the opportunity for the community to come and just talk about the gun violence that happens in Carbondale and about solutions.
And is that at the address here below?
It's at 309 East Jackson. Yep.
Okay, great. Thank you. If there are no other questions, we will let Jessica go. We appreciate her being on last minute. Thank you very much.
Can I just say, I want to thank Nancy and Jessica and all the violence interrupters. They had about a month or so ago met with our ED directors, some ED staff, the hospital administrator at Memorial to talk about how they could work together and support each other when these incidents do occur. So that's great, and they can reach out. So I wanted to share that appreciation with them about them. And then also we do have Carbondale crisis meetings that are happening with the Carbondale police. And Carbondale United usually sends 3 or more people to come and sit on those. And the Carbondale police mental health advocate, Lateria, I don't know if she's on today, shares information about individuals that may have mental illness or substance misuse issues or may be homeless that the police continue to come into contact with. They share information that's publicly available about those individuals. The judicial system's there, and everyone's kind of working together to discuss potential resources for the Carbondale police. So far, 37 people have been assisted or connected to resources, and just appreciate everyone who's part of that team and brings their input. And a lot of these things are so related.
Yes, thank you, Angie. We really enjoy participating in those meetings as well.
Well, thank you very much, Jessica. Thank you to Kathy. Thank you to our action team co-chairs. We are wrapping things up. Do we have anyone else from the membership that has any quick highlight, update, event that they would like to share? I'll open it up quickly before we close today's meeting. Go ahead, Patricia. I saw your hand up first.
Yes, I am Patricia Nardini from Specialized Equine Services. Our mission is improving the quality of life through the healing power of horses. I have to say we have a very effective program. Horse-assisted learning is very effective with trauma. And I want to publicly say we are so grateful for Senator Fowler and anybody and everybody who supported the Southern Illinois Made Expo this past weekend. The support there, we are going to build in the summertime. And I'm also impressed with how active all these agencies are. It's interesting. A lot of them are not part of my world, so it's informative to see and encouraged to see so much activity going out there. Thank you.
Thank you, Patricia. I saw Margot's hand go up next. Margot, if you want to go ahead.
Hi, yes, thanks. Can you hear me okay?
Yes.
Just making sure. Okay, thank you. I'm Margot. I'm the Community Engagement and Partnership Coordinator for the Marion VA. I did want to just take this wonderful time to let everyone know that we're having our first ever Veteran Suicide Prevention Summit at September 14th and 15th here at Marion. We want to invite all the community partners, all the agencies that are in the community that may or may not be working with veterans, or whether they know it or not, to come in and just to learn a little bit more about what we do at the VA. And not only just in terms of suicide prevention, but we'll have breakout sessions that include our homeless program specialists, peer support, whole health, military sexual trauma, women's health, all that stuff, just so you all that are, again, in the community know what we're doing, can meet with us. We want to really have a stronger connection and work and help out however we can for, again, you guys that are working with the veterans that are not. That's fine. We want to keep them where they're comfortable, but again, we want to make sure that you feel supported. So I did send the invite out to Fanta because there are limited seating and you have to sign up, but there's also opportunities to have a resource table at the summit as well for your own agencies. So just wanted to make that aware to everyone. Thank you.
Thank you, Margot. I saw Tony K next. Go ahead, and Tony K.
Yeah, I just want to, on behalf of St. Louis Area Food Bank, make an announcement that they are bringing their Food on the Move mobile food pantry to the Carbondale Towers. Their first distribution there will be August 8th, and they will be for the rest of the year, the second Tuesday of every month. So August 8th, September 12th, October 10th, etc., from 11 to 12:30. And that mobile food pantry is a walkthrough trailer where clients get to choose the foods they want to take from the pantry.
Great. Thank you very much, Tony K. Any other highlights? Angie Bailey, go ahead.
Yeah, so Fanta had sent out some information about the community resource survey. So we are continuing to collect information through the end of this month. And so if you received that email, everyone should have received it on the HSIDN. We are asking that you enter your agency's information program by program. So that we can then try to put that information into our electronic health record so that we can make referrals to community programs. This is kind of a first step in a longer term plan. There was one meeting held, and if anyone's interested in becoming involved and hasn't been part of this, you can let us know, but it is regarding trying to take a lot of our online directories or our lists, all those directory lists. We think there's over 30 different lists out there with all the different agencies, and working to try to get that into one system, one database, one program, or if not that, just have more coordination in the development of all of these lists. So we had an initial meeting. Then we're going to have a demonstration from some different platforms sometime in late September, dates still to be determined, and then try to make some decisions on what the group wants to do moving forward. And saying all of that, in the meantime, we're trying to take all of the resource lists that are on the HSIDN. They've been put into an Excel. And then we're trying to flesh those out and obtain anything that we have missed. So we're asking for individuals and agency programs to complete that survey. So if you didn't receive it, please let us know, but it would have been an email from Fanta about the community resource directories. And that is due Monday, the 31st.
Great, thank you very much, Angie. All right, I haven't seen any other hands raised. So we'll go ahead and wrap this up. Just a couple reminders for next year, we're going to a quarterly format. If you have any other updates on what you would like to see these meeting formats look like going forward, just email those to me, or you can give me a call. I appreciate all the feedback we received this morning and everyone's flexibility with providing updates on the spot and moving the agenda around. So with that, I will let everyone go. Enjoy the summer, stay cool, hydrate, and have a good weekend.
Thanks, Matt.
Thank you.
Thank you.
Thanks, Angie, for getting Carbondale United on the line.
Yeah, hey, I'm gonna put that announcement in the chat. Are you pulling things from the chat for the announcements, or would you rather me just email it? I'm trying to find the email from Fonta about the resource directory.
It's probably easier if you just email me. That
Okay.
will be on the physical document. I think people view that. I don't know if people go back and watch the recording or not.
Okay, that sounds good. All right, I will email that to you right now.
Okay.
Yeah, and I tried to text Nancy, and I think I texted one of the others, so yeah, okay.
Well, we
So I'm
appreciate
glad
that.
we got Jessica on. That was good.
Yeah, it was.
So, okay, all right, thank you so much.
Thank you. Take care.
See ya. Bye-bye.
Bye.